join us live on 680 CJOB. Cynthia Carr, as you look at the numbers released today, what is that data telling you?
Well, again, it shows that, the spread of this virus isn't random. And, when the virus gathers pace and momentum, you're going to see more opportunity for intense community transmission. And, right now, Southern Health has 232 active cases and accounting for 1 in 3 new cases since Friday. This is only 15% of the population, accounting for, a disproportionate number of new cases. And unfortunately, 7 out of 9 deaths since Friday are residents from the southern region.
Let's bring in Raywat Deonandan from the University of Ottawa. Ray, when you look at the numbers, we are still seeing that the test positivity rate provincially is almost 4%, still very low at 1.2% in the city of Winnipeg. Is that more hard proof to show people that vaccinations work? The high proportion of Winnipeggers are vaccinated.
I don't know what more information people need to drill that bit of wisdom home. It's absolutely true. The majority of hospitalizations are amongst the vaccinated. The majority of cases are amongst the vaccinated. Those who suffer the most, most cases amongst the unvaccinated. Those who suffer the most are unvaccinated. The way we get through this is through vaccination. And the longer it takes to cajole people to accept vaccination, the longer we suffer through this epidemic. So I'm open to ideas, like what more do we need to spell out to convince people that this is the way forward?
Cynthia, is this the right approach that the province is taking today, changing up the rules a little bit in terms of self-isolation for those in the Southern Health region?
Well, again, given the risk that less than 70% of eligible Southern residents are vaccinated, unfortunately, the answer is yes. I don't know if I want to say it this starkly, but I've heard other, physicians saying if you aren't vaccinated, you have a date with COVID coming because this Delta variant is just so transmissible. And studies have shown that within a household, transmission of Delta amongst unprotected people is pretty much 100%.
Understood. So what are the numbers telling you for the days and weeks ahead based on the information at hand?
Well, when I look at the active case rate, for example, just again as a reminder, the active case rate is 5 times higher per 100,000 in not vaccinated.
Raywat, is this what we saw in Alberta and Saskatchewan as far as those pockets of those provinces where case counts just exploded?
It's kind of similar. I think the situation in Alberta was far worse, to be honest, but it's a similar trend in that there are, as you mentioned, pockets of unvaccinated people that are the source of most transmission. The difference, of course, is in Alberta, the gates were thrown open and caution was thrown to the wind, and the assumption that the epidemic was over was declared far too early. Whereas in Manitoba, strangely, a lot of conservative approaches were taken, just not in coordination with sufficient vaccination. So again, the takeaway message to me is always that vaccination is the way forward, but it is distributed unevenly through the population. So there are elements of unvaccinated and non-immune people who are geographically clustered and socially linked. And we see that throughout the entire world, frankly.
Do you think, Raywat, going forward in your research, of course, there's going to be a ton of work that will be done after the pandemic, but can you see a time when we are studying how to handle these difficult situations as we saw unfolding in Saskatchewan and Alberta, where we are seeing heartbreaking stories of babies, of people of all ages requiring treatments and surgeries, simply unable to get it as a result of the hospitals being so filled with COVID patients? What is the solve on that? And ultimately, will we look to academics to try and lay forth a plan to how to deal with that?
Yes, well, we academics are mostly useless, as I think everyone accepts now. But about a year ago, I made the observation that, more than a year ago, that this was not a health crisis. It's a health systems crisis. If it was simply a health crisis, well, you make the vaccine and we're done. But as we've seen, that's not the case. The health systems crisis suggests that there are administrative barriers in place, distribution barriers, social barriers that prevent the solution from percolating as thoroughly and as evenly as it needs to be. So the answer to your question is, yeah, we got to figure this out for the next time. We have to figure out how to distribute resources quickly and effectively. We need to figure out how to be able to expand our healthcare capacity quickly and explosively. And we have to always have sufficient beds in place. Canada ranks near the bottom of OECD countries when it comes to having sufficient hospital bed space. And the rate limiting step for that is human resources. We don't have enough doctors and nurses. We've got to fix that quickly in the next couple of years.
Cynthia Carr, a lot of Winnipeggers are wondering, as the case counts go up and the test positivity rate goes up in rural Manitoba, province-wide Southern Health, does it spread to here in Winnipeg?
Well, again, as we've said before, we're a highly interconnected society. If we weren't, we wouldn't be in a pandemic. So absolutely, we go from hyper-local outbreaks, unfortunately, where there's a number of people who are not protected, and then that absolutely can spread throughout the province. And we need that not to happen. We don't want to be in the same situation we were last year, where we saw that escalation of cases from the end of October through to November, and pretty lonely holiday season for people.
And one more to you, Raywat. I think a lot of people, when they look at the numbers and now we can readily see who is getting sick with COVID, or at least testing positive with COVID among the vaccinated and unvaccinated. And I think it's very easy to say, okay, I understand why someone unvaccinated has tested positive. But again, we are seeing more people testing positive who have been vaccinated. What should we take from that? Is it eventually that if we were all vaccinated, if it was still circulating, 100% of the cases would be among the vaccinated?
That's exactly right. When everyone is vaccinated, then those few cases that remain will be amongst the vaccinated only. But they will be profoundly less serious and far less likely to result in hospitalization or death. If we can reduce this disease to a simple cold, then we win. And that's what vaccination does.
I have to leave it there. We thank you both for joining us this afternoon. And as always, Cynthia Carr, founder of Epi Research in Winnipeg, Raywat Deonandan, who is an epidemiologist from the University of Ottawa.